Hi, it's Jen Brewer, nurse specializing in wound ostomy and continence, and today I want to talk about a not so talked about phenomenon called intertrigo. Intertrigo is the occurrence of redness and denudement of skin in skin folds, under the breasts, in the pannus, in the groin, that occurs when the patient's tissue or the skin is in a dark, warm, and moist environment. So this can happen when, in the summer times, when they're excessively sweating because they may be outside and are doing different activities. It can also occur in the winter months when we've had too many warm woolies on. And again, it is a problem that can occur that, again, there's different treatment options for. One of the big options I do see quite often is the use of Canesten cream and or hydrocortisone and or the mix of the two. Although this can be effective, it doesn't help in stopping or treating the cause, which is that moisture. So the products that I do have today that I want to talk about will help a lot more with that moisture and can prevent it from coming back, as well as prevent it from reoccurring if this is an ongoing issue. So the first product I'm going to talk about is Intertrigo AG. Intertrigo AG comes in a box like this. There's actually quite a bit in the roll. It's about 350 centimeters or so. It is fairly expensive to buy it on Amazon. I think the last one I looked, it was about $140 per box. So again, you do get quite a lot for that. However, again, if the patient is buying this on their own, that's quite expensive. The nice piece to this, though, is that you can actually wash this and it's reusable. Again, for up to 5 days, as per the company. I've often seen people where we'll actually do a 10-day stint where we'll wash one and wear one and then interchange those until those 5 days are up. So the product itself looks like this. It is a textile, again, very similar to Under Armour, so it has those wicking properties to actually wick moisture away. If you can see, there's these small little dotted lines, and that's about the right amount that you need to actually be exposed on the skin. If that, you can't just jam it all up in and underneath into one of these skin folds, because if you do that, it's not going to really wick. So you want to lay it nice and flat and just let at least that much hanging out so that it allows for the moisture to evaporate. So again, this is a really great product, especially for preventing, or if someone has had it occur and reoccur. So again, you can keep using it, and it does work well to prevent it. One of the other products that I do see often that nurses are using is Kerlix gauze. Kerlix is AMD or PBMH impregnated gauze, which is an antimicrobial gauze. So that antimicrobial falls into the chlorhexidine category because PBMH is actually a large molecule chlorhexidine. So I like to put that in there so we know which one we're dealing with. But all antimicrobials, or most antimicrobials, kill both bacteria, viruses, and fungus. And usually with Intertrigo, there is a combination of both bacteria as well as fungus. So again, either one of these are good choices. If this is something that's all you have on hand, it can be very helpful. However, it has to be changed more frequently usually than the Intertrigo AG, sometimes up to BID or twice a day, again, because it gets wet quickly. We do know that on regular gauze, bacteria can penetrate through over 70 pieces. So this being gauze itself, yes, there is some antimicrobial in it, but again, the bacteria can attach and stay stuck in it. So sometimes the Intertrigo AG is a better fit, especially if it's over 2 centimeters. If you have an area of Intertrigo that's greater than 2 centimeters, I'm always probably going to pick the Intertrigo AG. If it's something that's lighter or you're looking for maintenance, that's especially when I would use the Kerlix. This Kerlix, again, there's quite a bit in this roll. You can cut it to fit and shape, and again, make sure that you're laying it flat so that there is some of the gauze itself exposed, so that you're allowing for some wicking to occur. So those are my 2 tips with these 2 products and when to interchange them. Again, if you do look Intertrigo up, you'll actually be able to see some examples, usually on Google, for it, because they kind of are in the places that we're not supposed to show. So hopefully that helps to clarify when it's best to use either product. Thanks. Have a great day.